Hi, good evening. So, welcome to Wednesday Reading Live. My name is Vandana PS, one of the reading trainers from Nidus Academy. So, how are you, everyone? So, how is your preparations going? Because we have an exam this week, particular week on this Saturday. Plus, it's a special day for us, all the women. Yes, it is Women's Day. So, you have an exam, right? It's quite funny. Anyway, so today, for the exam students, I'll be just giving you an introduction regarding what is Part A, how you have to approach Part A, and what are the important things that we have to be careful when you do Part A. Plus, I'll give you some tips and tricks regarding Part B. Okay, happy? So, let's start with Part A today. So, we have a self-prepared material for Part A today, that is interception. Not interception, just interception. Okay, so I'll just read the material, I'll underline important keywords from the material, plus I'll read the questions, I'll give you the answers, plus I'll discuss what is Part B. And I'm so sorry because I didn't prepare any question for Part B, but it's okay. You have a lot of Part B questions with you because already we have discussed a lot of questions in the live. So definitely you can take such a kind of material after the discussion class, I mean this virtual classroom. And then you can apply whatever I'm saying today regarding Part B to get 6 out of 6 for Part B. Alright, so let's start with Part A today. So good evening once again, and before starting the material, I just want to know how many students have joined this session so that I'll be happy. Yes. Good evening. Hi, a lot of good evening also, I'm happy. Yes. Hi Aditya, good evening. Yes, Marin, good evening. Yes, Sanjukta. Hi Sanjukta, this is after a long time you're attending my live, right? Where were you? Hi Jovita, good evening. Yes, Sharanya, good evening. Hi Afzana, good evening. Anne-Maria, good evening. Murali, good evening. Divya, Janie. Hi Chinchu, good evening. Yes, Agza, good evening. Hi Vinny, good evening. Good evening once again. Okay, so this is the material and I hope you can see the material on the screen. And in case if anybody is attending the live for the first time and if you just want to join this particular academy or Nidus Academy, if you want to really join to Nidus family, please do contact the number given on this particular screen. So you can call that number. Alright, yes. How are you Sanjukta? Yes. Hi Arya, good evening. How are you Arya? Yes, Sona, good evening. Hi Sona. Yes, Neena. Yes, Anu. Good evening. Good evening. Yes, Felba. Yes, Vincent. Good evening. Yes, Anju. Good evening. Good evening. Yes. So already you got the material from the same Facebook page called Nidus Academy Reading. And I hope you have taken the printout of the material. It's fine. It's okay if you don't have the printout of the material. You can look into the screen and find out the right answers. But still, if you have the material with you, it will be more easy for you to feel the material. അല്ലെ നമ്മുടെ കയ്യിൽ pen and pencil ഉണ്ടാവുമ്പോൾ അല്ലെങ്കിൽ with the paper and pencil if it is with you, it is quite easy for you to mark the material, underline the important keywords from the material, so it will be more comfortable. Plus, for the exam batch students, exam എഴുതാൻ പോകുന്ന കുട്ടികൾക്ക് I'll just give you a reminder. Don't worry about the reading module because you know that reading, of course it will be a toughest module, but as per your preparations going, alangil whatever you have prepared till now, it will definitely help you to find out the right answers at the time of your exam. So don't worry about your reading module. Okay, reading module പറ്റി നമ്മൾ എന്താ പറയുക ഒരു കാരണവശാലും ടെൻഷൻ അടിക്കേണ്ട. If you are attending this particular live session, definitely you can score Part A and Part B full marks. Trust me, I promise you. But don't skip the session. Get up. And during the session, I'll give you a lot of some tips and tricks. So please do watch the session completely. Okay, let's start the session. Hi, Ellen Albert. Good evening. Yes, Ellen. Are you attending the live for the first time? Because your name is quite new for me. That's why I'm asking. Okay. Hi, good evening. Yes, Albi, good evening. Hi, Reshma. Yes, Beulah, Sania. Hi, Anju. Good evening. Good evening. Yes. So the material is interception. So Part A, I think this last Monday, I've done a Part A live. It was very lengthy. I was detailing about Part A in detail, so that you can, if you didn't watch that particular live session, please do watch that. Definitely it will help you. Because last live Part A നമ്മൾ വളരെ ഡീറ്റെയിൽ ആയിട്ട് എക്സ്പ്ലെയിൻ ചെയ്ത് പോയ ഒരു Part A ആയിരുന്നു. And it was very helpful. Yeah, do trust me, it is very helpful. Okay, അപ്പോൾ അതുകൊണ്ട് കാണാത്തവരുണ്ടെങ്കിൽ പ്ലീസ് ഡു വാച്ച് ദാറ്റ് പർട്ടിക്കുലർ ലൈവ്. പ്ലസ് ഇന്നിപ്പോൾ നമ്മൾ നോക്കാൻ പോകുന്നത് വിത്തിൻ ദിസ് 15 minutes of time how we can complete Part A with some tips and tricks. Okay. So the material, I'm going to read the material. ഇപ്പോൾ കയ്യിൽ മെറ്റീരിയൽ കിട്ടിയെന്ന് just imagine you got the material. And just think you guys are in the exam hall. അപ്പോൾ exam hall-ലാണ് definitely you have this kind of tension. But don't worry about it, because tension അടിച്ചിരുന്നാൽ nobody is going to write this exam for you, right? നമ്മൾ തന്നെ വേണം എക്സാം എഴുതാൻ. So always remember that I have to write this exam. I'm going to write this exam. I'm just doing this exam for me. എനിക്ക് വേണ്ടിയാണ്, for my family, for everyone around me. So that means, yeah, give me a second. Yes. Okay, so when you get a material, first of all, just pray. ഒരു 2 സെക്കൻഡ് ഒന്ന് കണ്ണടച്ച് പ്രാർത്ഥിക്കുക. ഓക്കെ, ജസ്റ്റ് എന്തിനാണ്, ഇറ്റ്സ് ലൈക്ക് ഒരു മെഡിറ്റേഷൻ പോലെ ആയിരിക്കും. സോ ദെൻ look into the material. And there are a lot of students who are like, because of their eagerness, I don't know what is that thing, maybe because of the tension, they will just first of all look into the question. ചില കുട്ടികൾ അങ്ങനെയാണ്, ആദ്യം തന്നെ ക്വസ്റ്റ്യൻ നോക്കും. ക്വസ്റ്റ്യൻ വായിച്ചിട്ട് എവിടെയാണ് ആൻസർ എന്നുള്ളത്. It is actually fine, but you will lose a lot of time for that. The first reason is on the very same day, I mean exam day, you will be very tensed. നമ്മൾ ഭയങ്കര ടെൻസ്ഡ് ആയിരിക്കും. അപ്പോൾ അതിൻ്റെ ഉള്ളിൽ കൂടെ നമ്മൾ എന്താ പറയുക, ക്വസ്റ്റ്യൻ നോക്കുന്നു, പിന്നെ നമ്മൾ ആൻസർ തപ്പി കണ്ടുപിടിക്കുന്നു. ദാറ്റ് ഈസ് വെരി ക്വൈറ്റ് ഡിഫിക്കൽട്ട് ആൻഡ് ഇറ്റ് വിൽ ടേക്ക് എ ലോട്ട് ഓഫ് ടൈം. സോ ഡോണ്ട് ഗോ ഫോർ ദാറ്റ്. ജസ്റ്റ് ബി കാം ആൻഡ് ക്വൈറ്റ് ആൻഡ് ജസ്റ്റ് ടേക്ക് എ ഡീപ് ബ്രീത്ത് ആൻഡ് റീഡ് ദ മെറ്റീരിയൽ തറവ്ലി. മെറ്റീരിയൽ നന്നായിട്ട് വായിച്ച് മനസ്സിലാക്കുക. Okay, and that understanding will help you to find out the right answers. അവിടെ നിന്നായിരിക്കും നിങ്ങൾ ആൻസേഴ്സിലേക്ക് പോകുന്നത്. അതുകൊണ്ട് don't worry about the question, just focus on the material first. Text A, B, C and D. So the structure of Part A should be in your mind. അത് thoroughly, അത് എന്താ പറയുക, it is like a base. അത് ബേസ് ആയിട്ട് എപ്പോഴും ഉണ്ടാവണം. And do understand how many texts in Part A. We have 4 different texts in Part A, that is A, B, C and D. And when you complete text A reading, just collect a random idea. What is all about text A? എന്താണ് text A ൽ പറയുന്നത്? Then read text B completely without skipping any line. Then identify a random idea. Okay, എന്താണ് text B ൽ പറഞ്ഞിരിക്കുന്നത്? And what is in text C and what is in text D? Likewise, you can just analyze all these text. Clear? Then let's look into the questions. Okay, so I'm going to read the material. I will underline the important keywords from the material. Likewise, you can just look into the material along with me. So intussusception is a rare serious disorder which is one part of the intestine slides inside an adjacent part. Intussusception is the most common cause of intestinal obstruction in children. The cause of the most cases of intussusception in children is unknown. Though intussusception is rare in adults, most cases of adult intussusception are the result of underlying medical condition. Your intestine is shaped like a long tube. In intussusception, one of the part of the intestine, usually the small intestine, slides inside adjacent part. This is sometimes called telescoping because it is similar to the way it collapsible telescope slides together. Then this telescoping action often blocks food or fluid from passing through. Intussusception also cuts off the blood supply to the part of the intestine that is affected. This can lead to infection, death of bowel tissue, or a tear in the bowel called perforation. So these are my keywords from text A. See, what is text A? Text A is all about what is intussusception. എന്താണ് ഈ disorder? And how it can affect someone. എങ്ങനെ affect ചെയ്യുന്നു? They're talking about children as well as adults. So that's all about that. And in text B, we don't have any title. If title is mentioned, you can underline the title, right? So the main symptom of intussusception is severe, crampy abdominal pain alternating with periods of no pain. Painful symptom episodes may last 10 to 15 minutes or longer, followed by periods 20 to 30 minutes of no pain, after which the pain returns. After symptoms have been present for a while, some children may become lethargic, feel very tired. Small children may draw their knees up to their chest during the episodes of pain. So, yeah, these are the keywords from the first para. Other possible symptoms of intussusception include nausea, vomiting, rectal bleeding, or red jelly like stool, sometimes mixed with mucus. These symptoms begin suddenly, usually 1 week after a non-specific viral illness. So these are the keywords from text B. So what is all about text B? Text B is all about what are the symptoms, possible symptoms, plus what are the severe symptoms of this condition. And text C, we have a pictorial here. It looks like a procedure. I don't know whether this is a procedure. I'm going to read that. Intussusception, infant or toddler presents with abdominal pain and signs of an obstruction. Plain abdominal X-rays and or ultrasound suggest intussusception. Air or water soluble contrast enema to confirm the diagnosis and initiate treatment. Then if it is successful, enema, reduction of ileocolic intussusception, and if it is unsuccessful, enema, reduction of ileocolic intussusception. Then after successful enema, then you can go for observation, observe for signals, signs of bowel necrosis, perforation or progressive sepsis. If it is unsuccessful, you can go for a surgical procedure, open the laparoscopic, reduction intussusception, then resection of the necrotic bowel, primary anastomatosis, then appendectomy, routine post-operative care with nasogastric decompression, intravenous fluids, antibiotics while bowel function resumes. So these are the keywords from, as I already mentioned, this is all about the procedure. And in text D, a lot of risk factors mentioned, and risk factors can be asked in different ways in part A. Maybe they will ask you what are the side effects, what are the risk factors, what are the complications, what are the ramifications, likewise any other synonym, okay, it can be expected. So risk factors of intussusception. Risk factors for intussusception include age. Age is one of the risk factor. Particularly young children are far more likely than adults to experience intussusception. It is the most common cause of intestinal blockage in kids between ages of 6 months and 3 years. And sex is another factor. Intussusception typically affects boys more frequently. Then aberrant gastrointestinal growth during birth. Intestinal rotation is a condition when the intestine does not develop or rotate appropriately. This particular set of circumstances increases the chance of intussusception. Certain disorders like CF can raise the risk of intussusception. Then Henoch schiloin or sconline. Then purpura, commonly known as IgA vasculitis. Then Crohn's disease, celiac disease. Okay, so these are the risk factors of this particular condition. Okay, so that's all about my keywords from the question. So again, I'm going to collect, okay, text A is all about what is this condition, text B is all about what are the signs and symptoms, text C is all about the procedure, and text D is all about the risk factors. I hope it is clear for you, right? Yes, so I'm just coming back to your messages. Hi Anisha, yes, Sharon, Jocelyn, Anju, Megha, hi Megha, good evening, good evening. Okay. So now let's answer the questions. Intussusception. So don't forget guys, after part A, I'll be explaining part B. Please do watch the complete live. Okay, so the first question. Who is less susceptible to intussusception? I'm gonna just underline what are my keywords from the question. Then please, you guys do tell me what is your answer. What are your answers from these questions? Then I'll give you the answer keys. Alright. So first one, who is less susceptible to intussusception? So my keywords less susceptible as well as who. Okay, that's not necessary, but still. Then second one, which are the other conditions that could trigger the onset of intussusception? So my keywords, conditions, trigger, onset. Third one, how often the recurrence of pain takes place? So how often recurrence pain. Diagnostic methods carried out to confirm the presence of the condition. Diagnostic, then carried out, confirm. What are the typical intestinal changes that occur in intussusception? So my keywords, typical intestinal changes. The most severe sign of intussusception, most severe sign. How does gender act as a predisposing factor for the development of the condition? So gender, predisposing, and development. So these are my keywords from the question. And as human beings, we have this kind of overconfidence. Yeah, that is quite natural, I know that. We have this kind of confidence, I don't have to mark this keywords from the question because it will take a lot of time, and that time I can take for understanding finding out the answer. That is quite, foolishness. Okay, mandatrana. So don't do that. Always underline keywords because only through the keywords it will guide you. It is memorizing actually. നമ്മൾ keyword underline ചെയ്യുമ്പോൾ when you guys underline important keywords from the question, it will guide you. അത് അവിടെ മെമ്മറിയിൽ ഉണ്ടാവും. So don't do what? Don't forget to underline the keywords. Okay. So answers are yes, commenting. Everybody's commenting the answers and I'm so happy to see your answers. I just want to check your answers. I'm going to read your answers, then I'll just, check your answers correctly. But before that, I just want to know what are your answers for 1 to 7 set of questions. I will read your answers. Yes, everybody is commenting. So, yes, tell me what are the right answers. Yes, LV. Yes, Brian, first one. Okay, Jagan, yes, Jagan, this is your comment is the first comment. Yes, Jagan. First one is A, second one D, third one B, fourth one C, fifth one A, sixth one B, seventh one D, right? Okay, Anju, first one is A, then A, Saksa, A, first one is A, Anmaria, Nina, Aditya, Janie, Brian, Jovita, Marin, all right. Yes, LV, first one is D, second one is D, third one B, C, A, B, D. All right. Then LB, first one is A. Alfonso is saying A. Okay, Divya, A, D, B, C, A, B, D. Yes, Shilpa. Yes, Nina, A, D, B, C, A, B, D. Okay. Beulas, I think same answer. A, D, B, C, A, B, D. Okay. Yes, Liji, same answer. Yes, Afsana, Marin. Okay. All of you are commenting your answers very well. Yes, Megha. So now I'm going to give you the answer keys for this questions. Okay. So the first one, yes, who is less susceptible to interception? So where is it mentioned? Less susceptible, who are affected? Yeah, of course, I just told you what is the overall idea from text A, right? I hope you guys remember that. So, the first one is from A. Okay. So, who is less susceptible? If it is like a short answer question, I would say that is adults. So, that is mentioned in text A. As you can see here, in this particular text A, though interception is rare in adults, that means very less. Okay, so answer is from A. And second one, which is, which are the other conditions that could trigger the onset of interception? So, what are the other conditions? Actually, answer is D. Okay, so D is the right answer. Yes, Vinny, first one is A. Yes, Albi. Okay, Ajin, hi Ajin. A, D, B, C, A, B, D. Okay, Ajin. Okay, Sanjukta, it is first one is A, second one D, third one. Okay, first one you didn't get, right? Okay, first one is A. Okay, second one D, third one B, fourth one C, fifth one A, sixth one B, seventh one D. All right, Murali, A, B, D, C, A, B, D. Okay, let's see. So I'm going to write the answers here. Please do wait 1 second. Okay. So second one is D. And third one, I would say that is, I don't know whether your answer is right. Okay, you guys, it is commented as B. Okay, so that is B. Then fourth one, actually answer is diagnostic methods carried out to confirm the presence of the condition. That is mentioned. Yeah, diagnostic methods, procedures. It's C. Typical intestinal changes. That is from A. The most severe sign of interception, that is B, of course B. How does gender act as a predisposing factor? So gender, sex, okay, that is mentioned in D. So answer is D. How many got 7 out of 7? It was very easy to find out the answers, right? Because already we read the paragraph line by line and I just explained everything in detail. So please do tell me, anyone with 7 out of 7? First one is A, second one is D, B, C, A, B, D. If any doubts also, you can just comment it here. Endingalum doubt undo? Any doubts regarding 1 to 7 set of questions? Or how many got 7 out of 7? A, D, B, C, A, B, D. Very good, Lizzie. Very good, Diya. You got 7. Yes, Divya. Very good. Very good, Divya. Sorry, Diya. Very good, Diya. Alfonso, A, D, B. Okay. C, A, B, D. Very good. Very good, Alfonso. Okay, 7 out of 7. Very good. Yes, Jagan. Very good, Jagan. Hi, Ajin. Yes, 7 out of 7. Excellent. Yes, Mega. 7 out of 7. Aditya, A, D, B. Okay. C, A, B, D. Very good, dear. Again, 7 out of 7. Yes, Albi, Nina, Brian, 7. See? Okay, so definitely when you write your exam as well, you will get 7 out of 7. Now it's time for 8th question. Which drug must be followed during the post-operative care once the bowel function resumes? So my keywords, drugs, followed, post-operative. Okay, so these are my keywords from the 8th question. അപ്പോൾ 8th question ഒന്ന് വായിച്ച് നോക്കിയേ. വിച്ച് ഡ്രഗ്, ദേ ആർ ആസ്കിങ് വിച്ച് മെഡിസിൻ, ഏത് മെഡിസിൻ ആണ്. ഓക്കെ, ഏത് മെഡിസിൻ ആയിരിക്കും, ഏത് മെഡിസിനെ പറ്റിയാണ് അവർ പറയുന്നത്. വിച്ച് ഡ്രഗ് മസ്റ്റ് ബി ഫോളോഡ് ഡ്യൂറിങ് പോസ്റ്റ് ഓപ്പറേറ്റീവ് കെയർ എന്നാണ് പറയുന്നത്. സോ ഐ തിങ്ക് ആൻസർ ഇസ് ഫ്രം ടെക്സ്റ്റ് സി, റൈറ്റ്? യെസ്, ഒന്ന് നോക്കിക്കേ, എവിടെയാണ് ആൻസർ? ഇസ് ഇറ്റ് ഇൻ ടെക്സ്റ്റ് സി? Yes, yes. Yeah, right answers. Everybody got the right answer. Yes. Oh, is it that much easy? Okay. Because everybody got the right answer. Yes. So, I'm going with your answer. Answer is antibiotics. Okay, antibiotics. And that is mentioned in text C, right? Yes. 8th one. How long should the painless periods of symptoms usually stands for? So, how long? Painless symptoms. How long, which means they are asking the duration. എത്ര നേരത്തേക്കാണ് duration. Okay, so what is how long? Definitely it will be timing. Time ആണല്ലേ? Yeah, so what is the time mentioned? How long? Yes, Beulah, your answer is right, dear. 20 to 30 minutes. Very good. That is mentioned in text B. Very good, very good. So when you, the thing is, see, already Beulah commented like, idana answer, this is the answer and this is from this text. So likewise, if you guys are commenting, the reason is, you guys will be able to find out the answers correctly for further materials. Plus, if you're commenting, so other students will be able to find it, okay, which is the right answer. അല്ലെങ്കിൽ ഏത് text ആണ്. Okay. So you guys are just helping your friends as well. Anyway, yes, Feba, 20 to 30 minutes. Yes, Brian, 20 to 30 minutes. Yes, Sania, 20 to 30 minutes. So again, 20 to 30 minutes. That is my answer. And it is mentioned in text B. Okay. What is another term used to describe the condition of intussusception as it resembles the collapsible telescope slides? So my keywords, another term, then collapsible. Okay, telescope slides. Okay, I'm just underlining these 3 words. Any other term for that? What is that one? I mean, 10th one. Yes. Okay, we learned telescoping. Very good, very good. Yes. What about others? Yes, Ania, it is telescoping, right? So, answer is telescoping. Telescoping from text A. Yes, Feba. Very good, dear. 11th one. The condition that occurs when the bowel tissue gets teared due to lack of blood supply to the intestine. So, condition. My keywords are, yep, condition, then bowel and blood supply. So these are my keywords. Lack of blood supply, actually it's there, yeah, negative word on it, so you can underline lack of. Okay, so that is my keyword. Yes, Anne Maria, Arjun, Jenny, yeah, it's yes, Alfonso, yes, Aksa, it is telescoping. And what about 11th one? What is the condition they have mentioned? Which condition occurs when the bowel tissue gets teared due to the lack of, I think it is perforation, right? So perforation, and answer again it's from A, perforation. So I think answer is here. It's a very direct answer, so that's why I'm not even showing which is the text and from which line. This can lead to infection, death of a bowel tissue or tear in the bowel. That is called perforation. Okay. And question number 12. What is the minimum age required by a child to get affected by intussusception? So my keywords: minimum, age, child. Yes. Everybody got the right answer. Excellent. Yes, Megha, LV, Jasna, Arjun, Alfonso, Jenny, Mall, Murali, Afsana. Yes. Okay, Beulah, it's okay, dear. It's a typo, right? Okay. Yes, Mary, Sania. Okay. That's okay. So what is the minimum age? They're asking what is the minimum age. Minimum age എത്രയാണ്? Yeah, what is the age mentioned there? Not maximum age, minimum age. Okay, yes, Jenny, it's not, they're not asking the maximum age here, they're asking the minimum age. Minimum you can write 6 months, okay? Yeah, answer is 6 months. Okay, that is the right answer. So 6 months will be the right answer. Yes? Okay, so that will be 6 months. Okay. Yeah, so that is the right answer, which is 6 months. Very good, very good. 6 months. Yes, Neelambari, actually, you don't have to write that 3 years there, because as I already mentioned, they are asking the minimum age. Minimum age in the starting, so that you can write 6 months, okay? Yeah. So that's all about that. Yes, Sanju, 6 months. Okay, 6 months. Yes, Anne Maria, 6 months. Yes, so that is mentioned. I mean, the 6 months mentioned in text D, right? Yes. Oh, all of you got the right answer. Okay, then 13th one. What additional characteristic may be present in the stool of a patient with intussusception resembling red jelly-like substance? So, I think direct answer. Characteristic. Then resembling, then red jelly-like. So, what additional characteristic is mentioned there? I think it is from text B, right? Because I'm just remembering those kind of words, red jelly like thing. So here, yeah, it is mentioned here, rectal bleeding or red jelly like stools, sometimes mixed with mucus. Okay, so answer is mucus. Very good, Aksa. Okay, yes, Afsana, very good, dear. Answer is mucus. Mucus should be the right answer here. So that is mucus. Okay, from text B. Yes. Alfonso, is not rectal bleeding, dear, because they are asking what is the additional characteristics. So instead of additional, the word additional in the question they have in the paragraph they have mentioned with. Okay, so answer is mucus. 14th one, the types of contrast enema used to confirm the diagnosis and initiate treatment. So types, enema, and initiate. So to start the treatment, what types of contrast enema they are using there? So types nu parayumbo don't write a single answer, it should be plural. For example, in the air in the matra ediyalla, that is a singular answer, but we need a plural answer because question is asking what types of. Okay, so what is the right answer? Very good, Aksa. Air or water soluble. Here you can do one thing. As we know, if you guys are writing air or, then what? Water soluble. How many words? 1, 2, 3, 4 words. It's better you can do one thing here. You can put a comma. Okay, you can don't write this or here. Instead of or, you can put a comma. That means 1, 2, 3. See? Okay, sometimes you can use your brain. So, yeah, so answer is air, water, soluble. Okay. That is the right answer. Yes. Yeah, very, very good, very good, very good. Sanjukta, see dear, and is not mentioned anywhere in the para. Don't write and, okay? Because and or is entirely different words. What is the difference between and or? And or in the para, it's quite different. It's just opposite. Or, which means either one. Apple or orange. Apple allengil orange. Apple and orange, which means random, both. Right? So, it's different. Yes, everybody have the same mistake. I mean, it's not or do just put a comma, okay? That means only 3 words. If you guys are practicing so in the original exam also, you will be able to write short phrases as your answers. Okay. Yeah, so 15th one. Other symptoms may manifest approximately 1 week after an initial dash illness. Symptoms manifest 1 week. So what about that one? Symptoms manifest 1 week. 15th one, any guess, any idea? No, right? Yes. Okay, yeah. That is non-specific viral. Very good. That is the right answer here. Non-specific, okay, and viral. Yeah. Okay. So always write if it is mentioned in the paragraph, the hyphen is mentioned. Please don't forget to put the hyphen. Hyphenated word anengil hyphen venam. Okay. So, and that is mentioned in text B, right? Yes. Unsuccessful enema reduction of dash should be followed by surgical reduction of intussusception. So, unsuccessful followed reduction. So, what about that one? 16th one. Yes, Brian. Yes, Divya, Albi, Nina. Very good, very good. Right answers. Yes, what about 16th one? It is ileocolic. Okay, ileocolic. This is the right answer. And this is mentioned in text C. 17th one, Henoch-Schönlein purpura, generally termed as dash, is one of the conditions that can enhance the risk of intussusception. So, what about 17th one? Termed as what? It's mentioned in text D, I think. Yeah, commonly known as IgA vasculitis. So, answer is IgA vasculitis. I'm just going a little bit fast because we have to explain part B, right? So, this is quite easy. I'm just going fast. IgA vasculitis. Okay. And 18th one, intussusception also leads to a loss of dash to the part of intestine, eventually resulting perforation. So, keywords loss, intestine and perforation. So, 18th one, that is blood supply. Okay, blood supply, which is from text A. And 19, dash is a condition in which the intestines fail to develop or rotate properly. Condition, my keywords are condition, intestines and rotate. So, answer is, what is the right answer for 19th one? Yes, intestinal malrotation. That is the condition. So, intestinal malrotation. Okay, that is the right answer. And last one, the primary indicator of intussusception is intestine is spasmodic that alternates with pain-free intervals. Yes. Okay, so what about 20? That's a very quite direct answer. Abdominal pain from text B, right? Yes. Okay, so these are the right answers. Okay, so once again, I'm going to read 15 to 20. 15th one is non-specific viral. 16th one is ileocolic. 17th one is IgA vasculitis. 18th one is blood supply. 19th one is intestinal malrotation. 20 is abdominal pain. Okay, so anyone got 20 out of 20? Not, yeah, 20 out of 20. Etra per konda 20 out of 20? Yes. Okay. I'm just eagerly waiting today how many of you got 20 out of 20. Okay, so after just commenting your marks, I'm just gonna be taking part B. Okay, I'm gonna explain part B. Yes. Okay, regarding part A, I'll give you some tips, okay? When you read part A, always think about the question. When you read the question, they will not give you the direct words. Okay, in the paragraph from the question, it will be entirely different. Questionil തന്നിരിക്കുന്ന വേർഡിൻ്റെ സിനണിം ആയിരിക്കും പാരഗ്രാഫിൽ യൂസ് ചെയ്തിട്ടുണ്ടാവുക. സോ വെൻ യു അണ്ടർലൈൻ കീവേഡ്സ് ഓൾവേസ് ജസ്റ്റ് കളക്ട് എ റാൻഡം ഐഡിയ. വെൻ യു റീഡ് ദ ക്വസ്റ്റൻ ആസ് വെൽ തിങ്ക് അബൌട്ട് ദ സിനണിംസ് ഓഫ് എ പർട്ടിക്കുലർ വേർഡ്. അപ്പോൾ ഇതിന് വരാൻ ചാൻസ് ഉള്ള വേറെ സിനണിംസ് ഏതൊക്കെയാണെന്ന് ആലോചിച്ച് നോക്കുക. That will be mentioned in the paragraph so that it will be very easy to find out the right answer from the text. Okay, അതൊരു ട്രിക്കാണ്. Second trick you can do is, I don't know how many students are doing that particular trick. Instead of underlining the keywords, some students will do something. അതായത് they will underline all the names. പേരുകളെല്ലാം അണ്ടർലൈൻ ചെയ്യും. They will circle all the numbers എല്ലാം സർക്കിൾ ചെയ്യും. They will just put a zigzag mark for brackets and all things. അപ്പോൾ അതുപോലെ likewise if you're just putting different what I can say, that kind of emojis or something to the keywords, it will be easy for you to connect. For example, the question is asking how many children are there. എത്ര കുട്ടികളുണ്ടെന്നാണ് question. And we know they are asking a number. ആ നമ്പറാണ് ആൻസർ നമുക്ക് അറിയാം. So if you guys have circled all the numbers, then you don't have to read any other lines there. You can just search all the circles. എല്ലാ സർക്കിളും സെർച്ച് ചെയ്താൽ മതി. Clear? Got that idea? I hope it is clear for you. Yeah. അപ്പോൾ നമുക്ക് അങ്ങനെ ഒരു ഈസി വേ ഉണ്ട്. If you guys are practicing, so it will be very easy for you. പിന്നെ ശ്രദ്ധിക്കേണ്ട ഒരു കാര്യം എന്ന് പറയുന്നത് എന്താണ്, മെജോറിറ്റിയും നോട്ട് ഓൾവേസ് ഐ എം സെയിങ് മെജോറിറ്റി യു ക്യാൻ ജസ്റ്റ് ഫോക്കസ് ഓൺ ബി ആസ് വെൽ എസ് ഡി. ഓക്കെ, അപ്പോൾ കൂടുതലും ക്വസ്റ്റ്യൻസും കാണുന്നത് ബി എന്നും ഡി എന്നും ആയിരിക്കും. സോ ഫോക്കസ് ഓൺ ബി ആൻഡ് ഡി എ ലിറ്റിൽ ബിറ്റ് മോർ. Okay, always all the texts are very important, but you can focus a bit more for B and D. Because ഒരു കണ്ടീഷൻ്റെ ആ ഒരു സെക്കൻഡ് സ്റ്റേജും അതുപോലെ ഫൈനൽ സ്റ്റേജ് എന്ന് പറയുന്നത് ഇറ്റ്സ് ബിറ്റ് ഇമ്പോർട്ടൻറ്റ്, സോ ദാറ്റ് യു ക്യാൻ ഫോക്കസ് മോർ ഓൺ ബി ആൻഡ് ഡി. Okay, yeah, so that's that. Now I'm just moving to, okay, let me know your marks. So nobody with 20. Very good, Albi. Yes, Beulah, very good. Yes, Megha. Yes, excellent. Yes, Nina, 20 out of 20. Yes, Sania, very good. Yes, Liji, 20 out of 20. Okay, so I think 5 students got 20 out of 20. Very good job. And reminder, yes, all of you got 19 and 18. Excellent, it is pretty good, but next time make sure you will get 20 out of 20. Okay, so don't make careless mistakes. Okay, so now it's time for discussing part B. How many questions in part B? നമുക്ക് എത്ര questions ആണ് part B യിലുള്ളത്? In part B, we have total 6 questions. So for one question, it will take 2 minutes. Don't take more than 12 minutes for the completion of part B. I'm saying this because, see, part B and part C, it's not separately they are giving you. It is B and C together they will give you. അപ്പോൾ ഒരുമിച്ചാണ് part B and part C തരുന്നത്. അപ്പോൾ എന്ത് ചെയ്യുക? Don't take that much time to complete part B, because part B will be very easy for you. Trust me, it will be very easy, very direct answers. So don't take a lot of time for part B. Take that particular time for part C. Part C ആയിരിക്കും നിങ്ങൾക്ക് കുറച്ചും കൂടി ട്രിക്കി ആയിട്ട് വരിക. അതുകൊണ്ട് don't waste time for part B. Just take the time for part C. Okay, so maximum time you can take for part B is actually 10 minutes. ഒരുപാട് ഡീപ്പായിട്ട് വായിച്ച് പോകരുത്. Don't do like a deep reading in part B. It's just like a random reading and find out the direct answer. Okay, and in part B it will be always about elimination method. Eliminate ചെയ്ത് ആൻസർ കണ്ടുപിടിക്കുക. It's fine if you didn't get that particular same line from the para. If you are eliminating option, that's fine. You don't have to search for where is my answer. എൻ്റെ ആൻസർ എവിടെയാണ് നോക്കണ്ട. If you are ready to eliminate other options, then definitely you will get the right answer. Alright, so don't worry about that. ഇനി അടുത്തത്, in part B, in any question like words like negative words, ഇപ്പം not, do not, does not, were not, if any like negative words mentioned in the question, if any negative words mentioned in the options, or if any negative words mentioned in the paragraph, please do underline the negative word. It will help you. അത് നിങ്ങളെ ഡെഫിനറ്റ് ആയിട്ടും ഹെൽപ്പ് ചെയ്യും. If any negative word is mentioned in the question as well as in the option and in the paragraph, please do underline the negative word. The reason is that I'll give you an example in the question. For example, if a question is asking you, the policy is asking you, or the notice is asking you, natural therapist not to do something. ഒരു കാര്യം ചെയ്യരുതെന്നാണ് പറയുന്നത്. Okay, not to do. അല്ലെങ്കിൽ parents not to do something. So the question is actually negative. അവരോട് ചെയ്യരുതെന്നാണ് പറയുന്നത്. So always we have a tendency to find out a positive answer. മനസ്സിലായി? നമ്മൾ സെലക്ട് ചെയ്യുന്ന ആൻസർ എപ്പോഴും പോസിറ്റീവാണ്. അതായത് അവർ ചെയ്യുന്ന കാര്യങ്ങളായിരിക്കും. വാട്ട് ദേ ആർ ഡൂയിങ് that particular option we will usually select. But question is asking what they don't have to do. അവർ ചെയ്യേണ്ടാത്ത കാര്യം എന്താണെന്നാണ് അല്ലേ. So when you read a question, if it is negative, please do connect with your options. Options ആയിട്ട് connect ചെയ്ത് വായിക്കുക. Otherwise you will lose the connection and your answer will be wrong. There are chances. അപ്പോൾ അതുകൊണ്ട് എന്ത് ചെയ്യുക, please be careful about negative questions. Plus, in an option, negative word is mentioned. ഇപ്പോൾ not എന്നാണ് പറയുന്നത്. Maybe in the paragraph it is like എന്തായിരിക്കും, പോസിറ്റീവ് വേർഡ് ആയിരിക്കും. ഫോർ എക്സാമ്പിൾ, ചിൽഡ്രൻ ഡു നോട്ട് ഗോ ഫോർ തെറപ്പി, അവർ പോവാറില്ല എന്നാണ്. ദാറ്റ് ഈസ് മെൻഷൻ ഇൻ ദ ഓപ്ഷൻ. But in the paragraph it is mentioned children always go for therapy. See, completely contradictory. So likewise you can eliminate that option. Why? Contradictory option. So whenever you see a negative word in the question as well as in the option or in the paragraph, do underline that negative word. It will help you. Okay. And second trick is, whenever you are seeing a word like all, 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 ellam nanu meaning, alle, and majority of the time we have a confusion with all and many. Okay, many എന്ന് പറഞ്ഞാൽ ഒരുപാട് എന്നാണ്. Nothing means that it is all. എല്ലാവരും അല്ല. Okay, so all which means everybody or everyone, everything, including everything. Many or majority which means a majority the part. അതിൽ കുറച്ച് കൂടുതൽ അല്ലേ, that is more. So don't be confused with all and more or many. It is different. For example, in the option it is mentioned all of the women. But in the paragraph it is mentioned majority of the women. See, both are different. Random different alla. It is entirely different. Okay, so likewise you can just connect with your language. And another thing you can be careful is the word only. O-N-L-Y, only. Only is a very important word. So whenever you see the word only in the question, option or in the paragraph, underline that word. അപ്പോൾ ഓൺലിയുടെ മീനിങ് എന്താ? ഇത് മാത്രം, ഓൺലി, solely, exclusively. Okay, but maybe in the paragraph it is mentioned for everyone. അത് മാത്രമായിരിക്കത്തില്ല, there are other options mentioned, so that is also contradictory. If only is not mentioned in the paragraph, you can eliminate that option. Okay, and another word is that you have to be careful is should, must, have to, need to, required to, important, vital, ഇങ്ങനത്തെ compulsory words നോട്ട് ചെയ്യാം. The words that is indicating some kind of necessary things or compulsory things, you can underline. ഏതൊക്കെയാ? must, should, have to, required to, then important, ഇങ്ങനത്തെ words. For example, ഇപ്പോൾ എന്താ പറയുക, in the option it is mentioned men should wear a proper dressing when they attempt a program or attend a program. Proper dressing ല വരണം, that is in the option. But in the paragraph it is mentioned men can be wear proper dressing when they attend a function. അപ്പോൾ അവിടെ വന്നപ്പോൾ അത് എന്തായി? ഇറ്റ് ഇസ് ജസ്റ്റ് ഡിഫറെൻറ്റ്. ഓൺ വൺ സൈഡ് ഇറ്റ് ഇസ് മെൻഷൻഡ് ആസ് ഇറ്റ് ഇസ് നെസസറി ടു ഡു ദാറ്റ്. ഓൺ അതർ സൈഡ് ഇറ്റ് ഇസ് മെൻഷൻ മേ ബി ദർ ഇസ് എ പോസിബിലിറ്റി ദേ വിൽ ഡു ദാറ്റ്. മനസ്സിലായോ? സോ ഓൺ ദ വൺ സൈഡ് ഇറ്റ് ഇസ് കമ്പൾസറി, ഓൺ ദ അതർ സൈഡ് ഇറ്റ് ഇസ് പോസിബിലിറ്റി. ഓക്കെ, സോ ദാറ്റ് യു ക്യാൻ എലിമിനേറ്റ് ദാറ്റ് പർട്ടിക്കുലർ തിങ്. അപ്പോൾ അതൊക്കെ ഇമ്പോർട്ടൻ്റ് ആണ്. ആൻഡ് അനദർ ഇമ്പോർട്ടൻറ്റ് പാർട്ട് ഇൻ പാർട്ട് ബി ഇസ്, ഇഫ് ഇറ്റ് ഇസ് ഗൈഡ് ലൈൻ ആണ് ക്വസ്റ്റ്യൻ എങ്കിൽ, സി നമ്മൾ പാരഗ്രാഫ് വായിക്കുമ്പോൾ ഓട്ടോമാറ്റിക്കലി നിങ്ങൾ മനസ്സിലാക്കുക, പ്ലീസ് ഡു അണ്ടർസ്റ്റാൻഡ് ദാറ്റ് ഇഫ് ഇറ്റ് ഇസ് എ ഗൈഡ് ലൈൻ ഓർ നോട്ട്. ആൻഡ് മെജോറിറ്റി ഓഫ് ദ ടൈം പ്ലീസ് ഡു ട്രസ്റ്റ് മീ, ഔട്ട് ഓഫ് 6 questions മേ ബി 4 questions വിൽ ബി ഗൈഡ് ലൈൻ ആയിരിക്കും. ഓക്കെ, ആൻഡ് 2 questions വിൽ ബി നോട്ടീസ് ഓർ സംതിങ്. മനസ്സിലായി? അപ്പോൾ അതുകൊണ്ട് ഗൈഡ് ലൈൻസ് എപ്പോഴും വരാൻ ചാൻസ് ഉണ്ട്. ഡു ഫോക്കസ് ഓൺ ദ ഫസ്റ്റ് സെൻറ്റൻസ് ഓഫ് ദ പാരഗ്രാഫ്. Maybe you will get the direct answer from the first sentence. Maybe you can eliminate from that particular line. So whatever it is, if it is a guideline, focus on rules and regulations and first sentence. If it is a manual, എന്താണ് manual എന്ന് പറഞ്ഞാൽ? Okay, set of informations about a particular machine or machine പറ്റി, or instrument, equipment, medicine. So likewise you can just connect with a particular object. Don't connect with the animal or human being. Okay, and always give focus for the first paragraph as well as the first 3 sentences. Clear? If it is a policy also, the same thing. And if it is from the third category, ഇപ്പം notice ആണ്, അല്ലെങ്കിൽ if it is an email or memo, always focus on the last para or last lines. Okay, again I'm not saying you will get that answer from that particular line, but majority of the time maybe you'll get. Okay, so focus on that one. Plus always do elimination method. Don't do any other method. നിങ്ങൾ വായിച്ച് മനസ്സിലാക്കി ആൻസർ നോക്കി, don't waste your time in part B, because part B will be very easy for you. Please do focus a little bit more. Just നിങ്ങളൊന്ന് ഫോക്കസ് ചെയ്താൽ മതി. Definitely you will get 6 out of 6. No doubt in that. Please don't എന്താ പറയുക, മാർക്ക് കളയരുത്. ബിക്കോസ് പാർട്ട് ബി ഈസ് വെരി ഈസി ഫോർ യു, വിൽ ബി വെരി ഈസി ഫോർ യു. ഓക്കെ, ട്രസ്റ്റ് മീ. സോ ആഫ്റ്റർ ദി എക്സാം റിസൾട്ടൊക്കെ വരുമ്പോൾ കമൻറ്റൊക്കെ വരിക, ഐ മീൻ ലൈവിലൊക്കെ വന്നിട്ട് ഓക്കെ ഇതാണ് മാർക്ക്, ഐ ജസ്റ്റ് ക്ലിയർഡ് റീഡിങ് എന്നൊക്കെ പറഞ്ഞിട്ട് കമൻറ്റ് ചെയ്യുക. യെസ്, ഐ ബി വെരി ഹാപ്പി ടു സീ യു ഓൾ ദെയർ. എനിവേ, all the very best, and we have a surprise. Yeah, as always, if you have exam on your on all Saturdays, we have Neetu ma'am's writing depiction at night 10 p.m. Friday, this Friday. Okay, അപ്പോൾ ഫ്രൈഡേയിൽ നീതു മാമിൻ്റെ റൈറ്റിംഗ് ഡെപ്പിക്ഷൻ ഉണ്ടാവും, 10 മണിക്കായിരിക്കും. പ്ലീസ് ഡു വാച്ച് ദ ലൈവ് സെഗ്മെൻറ്റ്, ഇറ്റ് വിൽ ബി വെരി ഹെൽപ്ഫുൾ ഫോർ യു. ആ ഒറ്റ ലൈവ് കണ്ടാൽ മതി, നിങ്ങൾ റൈറ്റിംഗ് ക്ലിയർ ചെയ്യും ഫോർ ഷുവർ, ട്രസ്റ്റ് മീ. Okay, so please do watch the live segment. Plus, please do share this particular live session to your friends as well, so that it will be helpful for them as well. Okay, so I hope it is clear for you. God bless you all the very best.